Hi, fellow educators. This is Becca Dodmead here. Today we're going to have a session on jcaho and the simulated patient care experience for the student. So first I'm going to share my screen. Okay, so the title is Surprise, It's jcaho. I'm sure we can all relate to the feeling of your heart dropping in your stomach when you hear this. The reality is jcaho serves a great purpose. It is a voluntary accreditation that many hospitals go through, both for the reputation that they get because of that and also for ultimately reimbursement purposes. Hospitals are a business, and so with that in mind, sometimes there is some strategy involved into applying for that accreditation. So what can happen is students can pick up on what staff is saying about jcaho. We probably can all look at these memes and have a chuckle through the lens of someone that understands that jcaho is important, but there certainly is a lot of joking that occurs among nurses and other healthcare workers about, for example, putting away your drink when jcaho comes in the building. The reality is the hope is that we are all doing what's right as far as patient care and safety, regardless of whether jcaho is in the building or not. So a big question in the planning of this session was, is jcaho important to students? And the answer is yes. It isn't just about educating students what jcaho is motivated to do, what their purpose is, their mission. It's also about instilling good habits, regardless of whether they're there. So Joint Commission accreditates over 20,000 healthcare systems in the U.S. And so for students, they're going to run into this, whether it's while they're in school or after they graduate. Even if they're not in the hospital setting, Joint Commission does look at other areas, not just inpatient hospital. Since in undergraduate nursing programs, we do often go into the hospital setting for clinicals, I chose this particular scenario for this session. And so in short, with students, you want to start instilling behaviors in line with best practice. The simplest example of this is hand hygiene. Do they do hand hygiene when the instructor's standing there because the instructor's there or because it's the right thing to do? We hope that it's because it's in line with best practice and it's the right thing to do. But where that starts is educating them. And in this instance, part of that education is going to be a simulated experience.
It is important that nursing educators reinforce to students that accrediting bodies are not meant to be worked against. Students should know that accrediting bodies such as Joint Commission are to be worked with towards common goals of the best patient care possible. A simulated experience for nursing students starts with them giving reports and then noting a jcaho auditor waiting for them at the nurse's station. The simulated experience includes the students being asked the following questions. It is important that
So that video was a way to introduce the simulation and then also to give an example of thinking outside the box, a way that you can show a student a situation even if you're unable to have a simulated environment, or if perhaps you're trying to engage them and mix it up, if you will. The sample questions, just kind of some simple examples, things that jcaho would typically ask and things that would be important to a student. What are patient safety goals? Where can I find policies? And how often do you assess pain? So the first two questions are kind of universal, right? You may see that those regardless of the facility that you're in. Finding policies is certainly very facility specific, but it also is a way to introduce to the student that if you don't know something, it's incredibly important to know how to find the policy. It's not realistic to think we're going to be able to figure everything out in an instant. And so this is part of instilling a behavior that instead of worrying about knowing all this stuff, it's more that they're resourceful and know what to do when they encounter things that they're not sure of, which ultimately results in better safety, better patient care. So the jcaho Hospital National Patient Safety Goals: identifying patients correctly, improve staff communication, medication safety, appropriate alarm use, infection prevention, safety risks being addressed, and preventing mistakes. When you look at this, it's incredibly self-explanatory, pretty straightforward, all things that you would expect. The reality is there are opportunities for improvement in our profession and in healthcare in general for these topics. So again, for our purposes today, I've been focusing on infection prevention. It's universal and it's very simple. Hand hygiene is tried and true. We know how to prevent infection, and adherence to certain behaviors is an important component of that. So something that was very interesting to me when I was doing my literature search is that the evidence on simulation suggests that debriefing is extremely important, but also overlooked. So for all of my colleagues that are watching this session, I just want to bring this up because we may plan the simulation very well, and we may plan the questions, the visual aids, all the ways to engage the students. But if we don't debrief, we might not be able to help solidify that learning and ultimately make the session, the simulation session, the best that it can be for the student. So I thank you all for attending this session, and I look forward to great conversation about this. Have a great day.